Okay. Now in this session, I am going to discuss about the alpha 1 blockers as far as their antihypertensive actions are concerned. Okay. So we will see how the alpha blockers they reduces the blood pressure. What are the limitations? We all know that alpha blocker are not the first line drugs. What are the reasons for that? And in which hypertensive cases they are used. Okay. So now for that you have to first understand where the alpha 1 receptors are present. These receptors are present on the peripheral blood vessels. They are present on the peripheral blood vessels and and when the alpha 1 receptors are stimulated, there will be vasoconstriction. There will be vasoconstriction. So when you give the alpha receptor blocker, what will be the effect? There will be a vasodilatation. There will be a vasodilatation, and these vasodilatation, it will lead to reduction in the vascular resistance. Peripheral vascular resistance. And as the peripheral vascular resistance reduces, okay, you can check in the description box. I have mentioned the link for the different terminologies in the cardiovascular pharmacology like preload, afterload, peripheral vascular resistance. Because the peripheral vascular resistance is the main factor for the rise in the blood pressure. Okay, and because of the reduction in the peripheral vascular resistance, there is a fall in the blood pressure. Okay, so now we have achieved our first target, how the reduces the blood pressure. That is one. But which are the limitations? Now these alpha 1 receptors, one thing is that these fall in the blood pressure. This fall in the blood pressure is associated with reflex sympathetic stimulation and it will lead to tachycardia. That is one. This fall in the blood pressure, it will reduces the renal blood flow, and as it reduces the renal blood flow, there is a decrease in the glomerular filtration rate, the urinary function is impaired, and ultimately it will lead to salt and water retention. Salt and water retention. Okay, and these will lead to fluid retention and tolerance to the antihypertensive action. So this is the second problem. First problem is the tachycardia, then fluid retention, then tolerance. Then the another problem is the alpha 1 receptors, they are also present as I told you in the eye, and they alpha 1 receptors are stimulated, there is a mydriasis. So when you give the alpha blocker, there will be meiosis, and these meiosis, it will lead to diminution of the vision, diminution of the vision. Another problem with the alpha blocker is that this alpha 1 receptors, they are present on the nasal mucosal blood vessels, and when there is a nasal mucosal blood vessels, when there is a blockage of these vessels, what will happen? That there is a nasal, there because of the vasodilatation, there is a nasal stuffiness, also nasal blockage. Okay, and another problem is that these alpha 1 receptors, they are primarily involved in the coordinated contraction of the vas deferens, and it will lead to the ejaculation. So failure of the ejaculation is also there. Failure of ejaculation is also there. So if you can see in nutshell, there is there is a tachycardia, fluid retention, tolerance, then nasal stuffiness, difficulty in the vision, failure of the ejaculation. All these are the reasons that why the alpha blockers, they are not the first line drug. We are having the better drugs. Then the next question is in which condition it is preferred. That you all know that alpha 1 receptors are also helpful in the treatment of benign prostatic hypertrophy. Okay, these I have already the link how the alpha blockers are helpful in the treatment of benign prostatic hypertrophy. You can also find in the description box. So whenever the patient is having hypertension with benign prostatic hypertrophy, alpha blockers are the preferred antihypertensive agents. Otherwise, they are not the first line antihypertensive agent. Thank you.